Hi folks, this is Dr. Jim Anderson from Anderson Podiatry Center, and I'm here to talk to you about fungal nails and ingrown nails. The two of them kind of go together sometimes. And before I go much further, I'm going to ask you to subscribe to our YouTube channel. I always tend to forget this until the very end, so I'm trying to be good about it today and mention it in the beginning because we really do appreciate the views and the comments that we get. But let's talk a little bit more about onychomycosis and ingrown nails. So what is onychomycosis? Well, that's simply a nice fancy term for fungal nails. And a lot of you have fungal nails out there. And it may only be causing a discoloration in the toenail, so it becomes kind of yellow and discolored, or in other cases the nail may become deformed, therefore it might curve into the side of the skin on the side of the nail, therefore creating an ingrown nail, or the nail might just become thickened. And when it's thickened, that also will create more pressure, especially when you put a shoe in and that nail might be digging in on the side of your toe. So be aware that in many cases we do a procedure. It's done in the office. It's quite simple to do, where we remove the edge of the nail, we numb the toe, remove the edge, put a chemical there so the edge doesn't grow back. It's a permanent procedure. It's very simple for most people to do. It's very little recovery, no pain pills and such. But understand that oftentimes we get rid of the fungus and it's going to help with your ingrown nail. Just another option that you should consider. We do other treatments for toenail fungus other than laser, which is our primary treatment. We do topical treatments, and we also occasionally will use oral medication, but we're very careful to recommend this because it can be difficult for your liver to take, and we do recommend liver panel testing before we ever would do that. The number one thing that we do here is laser. It's a great new technology. We've been doing it now for a decade, and in many cases it's going to do two things. It's going to help with your toenail fungus, number one, and number two, if you happen to have especially a more mild ingrown nail, it can also help with that at the same time. So just some information I think that could be useful to you, and I hope you found this informational. And please, if you have any comments or questions, we always appreciate that. And don't forget to push on that subscribe button. Thank you for watching.